So this is a blood vessel. I know it looks gigantic, but it's magnified, of course. So notice that the lining is this thin line. Okay, so this is the tissue that we're talking about. You can just ignore these other layers in the wall. This is simple squamous epithelium. You see the nuclei of the squamous cells here. Okay, so whenever you see a blood vessel, you want to just take a second to look at the blood vessel's lining. This is a blood vessel here. Again, you can see blood cells. This is simple squamous. This is also a blood vessel. So again, simple squamous. And this is also a blood vessel. This looks a little different. The lining is kind of squiggly because this is an artery, this is a vein. It doesn't matter, but again, the lining is always going to be simple squamous. Okay, so that's what that is there, that innermost line that you see. Okay, so I just want to show you what this would look like if we were looking at a serous membrane. Remember we said that simple squamous is also found in our serous membranes. So this is what's called a surface view, like we're looking down at a sheet of squamous cells, down at the sheet of simple squamous epithelium. It looks to me like a bunch of fried eggs in a pan, but you will be seeing this from the side. Okay, so I just want to show you the same tissue from the side. And so again, notice how thin it is. So this is covering an organ that happens to be covered by a serous membrane. So this is our simple squamous epithelium. So it's a little tricky to identify this tissue at first. That's why I always like to have you guys identify it in the wall of a blood vessel. And that helps you, it gives you a little bit of a clue, because hopefully you'll recognize this is a blood vessel. Okay, and then you'll know that that's simple squamous. Okay, let's go on to simple cuboidal. Okay, so make sure there's no one behind me that can't see. Okay, so this is simple cuboidal here. Actually, this is from the kidney, and this is the best organ to look for simple cuboidal because all these tubules in the kidney are lined with simple cuboidal. This looks a little different. These cells happen to be a little fatter, so the lumen is very, very small. I think this is a little bit more clear. And sometimes when people first start looking at tissue slides, it's confusing because notice how close these tubules are to each other, so it kind of looks like, almost like this is stratified. But I think the more you look at these, you'll start to recognize that these are two individual tubules that are both lined with simple cuboidal. And you can see it a little bit better here, even though the lumen's kind of fuzzy. Notice you can kind of see the basement membranes of these, maybe better in this next picture. See the basement membranes. So you can see these are individual tubules, and notice again the cells are about as tall as they are wide, like little cubes. Okay.
The white section is the simple cuboidal?
The white section here is actually the lumen.
Okay.
So these are the simple cuboidal cells here. You can't see the nuclei in all of them, but these are simple cuboidal cells. Okay. So all of this is the simple cuboidal and all of these tubules. Okay, so let's take a look at this next tissue. And what does this look like to you guys? This is simple columnar. Right, so you can see this isn't a different tissue. This is the underlying connective tissue. This is from the stomach. This is the lumen here. And so in the stomach, the lining is folded up so that it can expand as we eat. So that's why it looks like there's folds in it. And you can see how rectangular these cells are. So usually in simple columnar, the nuclei kind of line up near the basement membrane, which is right here. So it's a pretty neat little row of cells usually. This is the same thing. So the tissue is kind of going like this, again, because it's kind of folded up. This is a nice picture of it. You can really see the folds, okay? This is not quite as magnified, but that's a good picture of it. Okay, so this is, right, so you see cilia here. I will have a really clear picture of the cilia on the test. So when you see cilia, you know it's this tissue. This is the only ciliated epithelium I'm going to have you guys identify. This is pseudostratified columnar with cilia. So notice that it looks like this is stratified because nuclei are at different levels, but actually all these cells do touch the basement membrane. So it really is just one row of cells. This is the basement membrane here. So this would be our underlying connective tissue. And what are these cells? Goblet cells, very good. And this is the...
Extracellular fluid.
It might be some extracellular fluid because there would be some mucus up here secreted by the goblet cells. This space is the lumen. So where do we find this tissue in the body?
Intestine?
The where?
Intestine?
Remember, cilia moves the
Esophagus?
mucus.
Lungs.
Yeah, respiratory tract. This lines most of the respiratory tract. You actually can call this respiratory epithelium. You know, this is kind of similar though to the tissue that lines the intestines. This is actually what we'd find in the lining of the intestines.
What is the tissue underneath the basement?
This actually is loose connective tissue. It's areolar. And it kind of looks like it, right? You see what looks like some fibers here, but not a lot of fibers. That is areolar. And areolar is really common. It actually is usually found underlying epithelium pretty much everywhere. This looks more like a dense irregular, but it might be areolar. Sometimes it's kind of hard to tell. Okay, so notice that this label just says pseudostratified epithelium. It's okay to drop the word columnar. It's kind of common just to call it pseudostratified, but you really should include ciliated. This is really, like, they should have called this ciliated pseudostratified, and I want you guys to include that, okay? Okay, so these are great pictures of this tissue. Okay, so let's take a look at something else. Oops. Okay, this is... Notice it looks like many layers of cells, right? So this is a stratified epithelium. You guys have two types.
It's on the outer skin.
Close. This is actually the same type of tissue as the epidermis, almost. This is non-keratinized. So this would be stratified squamous from inside the body. This is actually from the esophagus. And so when you see that it's stratified, just look at the cells near the lumen and ask yourself if these are flat squamous cells. And you can see that they are. I mean, I think it looks like these are pretty flat out here. There's some pictures that show that a little bit better. And so that is how you know it's stratified squamous, and you can really see that here. You can see how flat the cells become. This is the same thing up here. This is all stratified squamous. This is a good picture of it. You can really see, as these cells are exfoliated, you can see how thin they are.
Even beneath it, like the bottom part, is that also, that's all, no, right above it?
Oh, here?
So, yeah.
This is part of the tissue. This is part of the stratified squamous. In stratified squamous, the deeper layers of cells are not squamous cells, really. They're more like cuboidal or what's called polyhedral, meaning they have many sides. But they become squamous as they go toward the surface. So it's named after the way the cells look up here. Okay, let's take a look at one more. Okay, so this is another stratified epithelium. What do you think this is? What was that? Someone say something? The other stratified epithelium that we talked about is transitional. So this is transitional. This is from a bladder that is empty, which is the only way you will see it. And you can see it looks like many layers of cells. This is underlying connective tissue in here. Okay, and notice that these cells are not flat. They're kind of rounded. You can see kind of a rounded appearance. This one looks almost like a columnar cell kind of laying down on its side. So this is just how transitional looks. The cells have different shapes, but they are definitely not flat. Now, if the bladder was full, they would flatten out, but you will not see it like that, okay? Also, notice you see binucleated cells, very common in transitional. So you want to look around for that. If you think you're looking at transitional, just look around, and there will be a binucleated cell somewhere in the picture that I give you, okay?
Are
And that's what that's
binucleated
pointing
cells
to.
most common in transitional,
Yes.
not
Yeah.
any other?
Yeah, not in other tissues. There probably are some in the other tissues, but not in transitional. There's a lot. Okay. And this is also transitional. All of this from here on up. This is underlying connective tissue and muscle. Okay, so this is a nice picture of it. You see it here and also here. Notice again how rounded these cells are. They're not flat squamous cells.